I have patients' families coming to me and asking me, are they going to take the medications away from my dying parent or my child? And these are real facts that we're facing.
It's important to be part of a union because you have to have a voice.
Welcome to Union Talk. I'm Randi Weingarten.
Welcome, everyone, to Union Talk. And today we are talking about one of the most consequential things going on in Washington today that mostly no one knows about. And that's what Donald Trump calls the Big Beautiful Bill and what I call the Big Betrayal. And we want to kind of unpack it with people who will actually have to face the consequences of it in the field if this bill actually passes and becomes law. So that's why I'm so glad to be talking to Shannon Davenport, who is a mental health nurse and the president of the Alaska Nurses Association. Heather Brauth, who is a PACU nurse at Bacchus Health, I should say, dealing with post-op patients. And we had Sherry from Bacchus yesterday on a webinar that we were doing. So the nursing staff and the healthcare staff at Bacchus, is helping us all the time these days because you have such an amazing, fantastic union. So thank you so much. And Bacchus is in Connecticut. And then I also want to introduce Laquetta Mackey, who is the president of our Norfolk Federation of Teachers. And she was a third grade teacher for 14 years and then a pre-K math specialist. And most of the schools in Norfolk are Title I schools. So we wanted to really talk to the three of you because you can actually unpack when we talk about these huge Medicaid cuts or the cuts in nutritional services or what that means in terms of state budgets and therefore taking a hatchet to programs like Title I. You can talk about what this really means. So I'm really, really glad to have all of you. And I just want to do a couple of top lines before we get into my questions. When I say, frankly, that it's the bill that most people hate when they know about, there's several polls this week from various different nonpartisan polling companies. And one of them says that when this bill is known by people, it is viewed unfavorably by nearly a 2-to-1 margin of Democrats, independents, and non-MAGA Republicans completely oppose it, while MAGA supporters favor it. But the favorability then erodes even in the MAGA-verse when people hear about the cuts to Medicaid. And so what am I talking about when I say this? We don't know fully the Senate version, but let me even just talk about the House version. The Congressional Budget Office estimates that the bill would result in at least 13.7 million Americans losing health coverage. And that kind of health coverage are things like nursing home coverage for seniors, coverage for kids with disabilities. In fact, several kids in wheelchairs today just got arrested, or this week just got arrested at the Capitol for trying to actually make the point that they're about to lose healthcare coverage. We were with lots of moms today who were told by police to take their signs down. In fact, they disrupted a press conference we were doing with Moms Rising this week because the Senate, governed by the Republicans, do not want people to have signs up talking about what these cuts mean. It's really crazy. But separate and apart from, it's like losing our First Amendment rights to speak at the same exact time as we're losing so many crucial benefits. Second, after the Medicaid cuts, billions are supposedly being cut from the Supplemental Nutrition Assistance Program, otherwise known as SNAP. But this program is our nation's most effective tool to combat hunger. Then, for families who have kids in college, Pell Grants are going to be cut. Other grants are going to be pulled back. Subsidies are going to be pulled back. It does appear from our mathematics, about 5 million students are going to lose the financial aid they have right now to go to college. There's a big piggy bank benefit to the rich on vouchers, meaning that if instead of just getting a deduction for giving money to the Catholic Church or to a school, there's going to be an extra special tax cut for the rich that becomes a tax credit. So essentially, you're getting back, if you're rich, a $1 return on your investment, and the school also gets the money. They're not doing that for public schools. They're just doing that for vouchers. And then they want to stop states from being able to do guardrails on AI, the most important safety measures that states are doing, that the federal government is doing. I can go on and on. And why are they doing all of this? It's basically to give additional tax breaks to the rich. So, and it's also going to increase the deficit. So it makes no sense to me. What's happened is that the president has such a megaphone that people don't really know what the effect of this bill will be on their lives and their kids' lives and their grandkids' lives. So that's why we wanted to talk to people in the field who will see it firsthand. And so that's why I want to first ask Shannon, and I want to actually ask all of you, and then I'll ask you some specific questions. But, I call it a big ugly bill. I call it a big betrayal. But what have you seen about this bill, and why are you on this podcast talking about it?
Well,
other than I invited you.
So first of all, thank you for having me. We actually call this the desecration of humanity bill. As a mental health nurse, my population of individuals is actually directly affected by these cuts. We're a very large state, but we have a smaller population. When you think about it, for such a big state, we only have about 500,000 people. So, and over 68% of our population is actually covered by Medicaid. And 92% of them are our mental health population. So I've had patients come to me and are scared because they're not sure how they're going to get their medications. They're terrified that all the recovery that they've done, all the work that they've done is going to go away because they won't have Medicaid to help support them with their outpatient therapy or their medications. On the other hand, I'm also a hospice nurse. So I have patients' families coming to me and asking me, are they going to take the medications away from my dying parent or my child? And these are real facts that we're facing, not even to assess how the rural population that we have here. We have a very large rural population here in Alaska, and they're predominantly covered by Medicaid. These are kids who are going to go without preventative care, basic vaccinations, basic checkups. You're going to see more people in our ERs, more people in our hospitals, and sicker people who are highly acute that we can't care for.
Is there even enough, Shannon, rural hospitals? Like, what will happen with the rural? The state is so rural and so expansive. If families can't go to like a country doctor, what's going to happen?
So up here we have what's called medical aids. Basically, for a 100-mile radius, you have one nurse. to cover 100 miles, and that encompasses a number of smaller villages. So you think about it that we've already been told that hospitals are being cut. We've already felt the pressure, both here in Anchorage and in our rural communities. And these smaller clinics, these smaller facilities are going to close. So you have hundreds of thousands of people without care. And where do they go? We don't have a road system. We can't just hop on, the freeway. A lot of our rural areas are by plane or by boat. And so, you're going to see increase in morbidity and mortality. You're going to see babies who aren't going to be able to make it because they don't have the care.
Yeah. Heather, you are in a different, I wouldn't say that Alaska and Connecticut are as different as night and day in the summer, but let's, for those people who understand what I was about to say, how many hours of light do you have right now, Shannon?
We currently just had our summer solstice, so we are currently at 22 hours and 53 minutes of daylight.
22 hours and 53 minutes. It must both be cool and freaky at the same time. And in the winter solstice, how many hours of daylight?
We will be down to less than, in some places, no daylight at all.
Wow.
In our northern parts of Alaska. In Anchorage alone, we'll be down to about 53 minutes of daylight come the winter solstice.
Wow. So this is one of the honors that I get of leading this national union, because you have people who are in so many different environments. But one thing, and I think we'll hear it, that Shannon and Heather share, and Heather's in the midst of the metropolitan New York area. The people in Connecticut don't always say it that way, but some of the biggest population centers in the country. And Bacchus is a hospital that really does serve the poor, the marginalized, and the working class, and always has. So Heather, the same kind of question as a nurse, talk about just the effects of this, the importance of Medicaid for our communities, and the effects, what would be the effects of these draconian changes?
Well, thank you so much for inviting me. I am honored to come on and discuss such an important and potentially life-altering bill for so many of the members of our community here in Norwich. At Bacchus, which is in southeastern part of Connecticut, about 50% of the women that deliver babies at Bacchus Hospital utilize the services of Planned Parenthood as well as Medicaid for their insurance. So one of the huge cuts that they're looking at in this bill is to rip apart Planned Parenthood services.
Right.
So, Planned
basically
Parenthood,
completely decimate them.
Correct.
Go on.
Correct. Which is a wild, that would be a wild atrocity for our small community, but for the nation as a whole. I think that a lot of people don't even realize, right? I was reading an article that PBS had published that 1 in 5 Americans are on Medicaid and don't even know it at this point because
Correct.
they changed the name of it so many times, that people don't realize that the insurance, the state insurance or the partial state insurance or the co-insurance that they carry is actually Medicaid, and that it's going to be experiencing cuts with this bill. And a lot of people don't realize that Planned Parenthood is utilized by populations in a lot of states across this country, not just for the stigmata that's been associated with it of abortion. A lot of mothers are using it for care, obstetric care and prenatal care going into their deliveries. So they are actually utilizing the services all for contraceptive reasons, but also for birth planning and to have safe child delivery and get a birth plan in place in areas of the state in this country that they may not have access to those kind of services or obstetric services readily without the access to a Planned Parenthood type facility. So just that for our community would be a massive blow. In general, I was reading an article on the American Hospital Association that says that Medicaid covers almost 40% of births across the country.
Yeah.
half of the births, half of the live births in this country. So, I mean, that in and of itself is terrifying to know. I mean, we're not exactly known to be the most progressive country when it comes to maternal care and post-maternal care. We should be much higher, but of course we are where we are on the list. And to cut Medicaid for so many of these women that are trying to just have safe pregnancies would be an atrocity. Dismantling Medicaid is going to strip access to healthcare for some of our most vulnerable populations across the country. It's going to destabilize hospitals and healthcare systems. And the sequelae of that on our healthcare providers is going to be a massive burnout and a run from healthcare and bedside nursing and bedside care in general.
Already, we saw that in COVID, and this is going to be a huge blow. And I think I'm going to get to Laquetta in a minute, but I think I just want to dwell on this for a second because both of you are talking about, for those who are listening, the healthcare system is basically rests on three anchors: Medicaid, Medicare, and private insurance. And it's a really broken system because the hospitals basically run on Medicaid and Medicare. And when you start seeing this huge pullback of state funding, of federal funding, you already have a slow drip because Medicare and Medicaid funding has slowly been pulled back. But when all of a sudden you have close to $1 trillion taken out of healthcare, of course it's going to destabilize. And then as you add on to what both Heather and Shannon have said, Heather about maternal care, which you layer on how much Planned Parenthood, I'm saying this to our listeners so that you really hear it. Planned Parenthood does more about maternal care and protecting pregnancies and making sure that moms give birth in a healthy way than it ever does in terms of abortion care. And so when that's taken out, that makes it even worse. And then you see what is happening already where there's huge shortages in rural areas, and this makes it even worse. Effectively, we can count 13.7 million, but the destabilizing knock-on effects are going to be huge everywhere. Completely unlike what Mitch McConnell said today when he said to people, get over it when you lose Medicaid. I suspect that Mr. McConnell is not losing his health care. It is kind of like the let them eat cake that we heard before the French Revolution. It is so disgusting, that sense that we're not taking care of our children and of our families. And then, of course, what you both said about what the pressure then is on those who remain in healthcare. So I just wanted to really reemphasize what we see already. And then I want to bring Laquetta into this conversation because I want to do two things right now. One is, what happens if all of a sudden Virginia loses, I don't know, for the sake of argument, say it's $50 billion from Medicaid funding. What's going to happen to education funding in Virginia if one loses that kind of Medicaid funding? But what else is going to happen? So that's number one. But number two is what's going to happen directly to your kids in your schools, mostly Title I eligible, which means that we basically have kids whose families are at the poverty level or just above it or just below it. What's going to happen to the health care of your kids when half the kids in America get their health care through a CHIPS program or which is a Medicaid program?
Thank you for having me, Randy. We call this bill the reckless, nightmare, disaster, and very harmful to our students. The importance of Medicaid and supporting students in our communities are crucial. Many of our students are struggling. And so but by taking that program away and taking those fundings away, the kids won't have speech therapy. They won't have behavior specialists. They won't have their screenings. They won't have their assessments. When I looked at the numbers for our district, it's about 4,000 of our kids that have free Medicaid. And then we have about 300 that have reduced Medicaid. So that's a good portion of our students in the Norfolk public school system that utilize Medicaid. And it will be very, very detrimental to our students and their education. And not only will our students be affected, but you think about our teachers that taught and now are retired. They will be affected by it because they depend on Medicaid as well. You're talking about some of our teachers that have brand new kids, brand new babies. They will be affected by it. It's just terrible. I mean, there's so many things that will harm our students. They're already struggling and they're going to fall further behind with all these cuts.
Thank you so much. I want to go back to Heather first for one more question, if I may. I mean, I could ask all three of you many, many, many questions, but I know, just like you talked about and made the issues around Planned Parenthood real for people, I know you're also, if I may, worried because your father is a disabled vet. And what's going to happen think about what they've already done about programs in terms of the VA. But what's going to happen to disabled vets? Are they going to, have we gotten any, I've not gotten any notice that veterans are going to be exempted from these cuts. What's going to happen? And what message does it send?
The first person that I thought of obviously was my father. But then I thought to myself, oh my gosh, my cousin is a bronze medal recipient, Army Ranger, works for the Department of Defense now. My brother is a retired Air Force pilot, flew C-300 Galaxies for the Air Force. They're all retired military. And my father's the only one who is totally and permanently disabled, having been shot in Vietnam and coming home with a Purple Heart. So he's the one that I think about the most, but military families in general and families that have disabled vets or vets that came home and now are struggling with issues of PTSD, let's say. And I think about them and I think to myself, how horrible is this bill potentially going to be for them? If this cuts some of their benefits, restricts their ability to seek mental health care or physical care in a hospital setting, our veterans shouldn't be choosing between groceries and a life-improving surgery. They shouldn't be choosing between rent or mortgage or preventative care. And cutting funding will promulgate cuts to veterans that have put their life and personal well-being on the line for our freedoms so that we don't have to worry about whether we can afford to have a quality of life. And the reciprocity that is potentially not going to be given eludes me. I find it appalling. I had a conversation with my father yesterday and I said, what are your biggest concerns when it comes to this bill? And he said that because of some of the wording in the bill, he's actually concerned that they could potentially try to tell him that he has to work in some sense to get some of the healthcare benefits. But if he works at all, he is no longer eligible for his total and permanent disability benefits through the VA. So therein lies a terrible catch-22 for any and all of our disabled vets.
Yeah.
And the cutting and gutting of Medicaid would potentially take away their ability to reside in long-term care facilities, memory care units, assisted living facilities, and their access to home care. And all of those things.
You mean everything that is absolutely imperative for any of us who have elderly parents, because we can't do it. We can't stop our lives to be there 24/7 for our elderly parents.
Correct.
When you list that list, that's what I hear you saying.
Yep. It is our most vulnerable peoples who cannot perform the activities of daily living on their own volition and require assistance. Those are the people that this bill is taking money from. Does that make an ounce of sense?
No.
Not even a little bit.
And I think the question I want to ask all of you, and we try to do this for like about 45 minutes, and I can't thank you enough for all of your time. I saw all of your faces when I said, oh yeah, and they're doing all of this to maintain the 2017 tax cut for the rich and to make it more. So like, what does it say? I mean, I'm sure we all know people, I don't want to put anybody on the spot. I'm sure we all know people who voted for Donald Trump. I'm sure the reasons that a lot of people voted for Donald Trump are because of, they thought that he would help people have a better life. We had a podcast a few months ago where we had from the same union, a member who voted for Trump and a member who voted for Harris. And we had like a really intense but good conversation about why and trying to model that. But do you think anybody who voted for Donald Trump thought that this was going to happen? That they were going to lose benefits so that the rich could get more? I see you're both shaking your heads. Oh. I'm not sure the podcast listeners will be able to see that.
I know for myself, I come from a predominantly red state, and I have friends that voted for Donald Trump. And I can see when he initially ran, like I could see the benefits. I could see what he was saying, and it sounds great. But the reality of what we're seeing now is terrifying. It's terrifying as a nurse. It's terrifying as a parent. I'm afraid for my own parents who are elderly and going to need home health care and potentially assisted living or in a nursing home. And these are the people that are affected. It's not about the numbers. It's about people. For me, I think that's something that we hear about numbers all the time, but the reality is the faces. It's my face. It's Heather's face. It's your face, Randi. It's Laquetta's face. It's all those individuals who were the ones who are affected, not what I call the ivory tower people, the billionaires who live in their ivory towers. It's our families. It's the people, our communities. It's our neighbor. And it's a very dark time right now. And I can honestly say I'm scared for what the future holds if this goes through.
Laquetta, I want to ask you this question too. If you could speak directly, I mean, a lot of us speak by being on the streets like we were at No Kings and, be out there basically saying, no, you have to listen to us elected officials. But if you could be out there directly, if you could talk to one of these legislators who are voting for this bill in the Senate, what would you say to them? If they were on this podcast, what would you say? Laquetta first.
I would say, please do not cut the Medicaid, do not cut the SNAP programs. Those things are so important and vital to our students in the public schools. When I looked at the numbers, we have over 12,000 students and families that are on the SNAP program. You're talking about kids that won't be able to eat. They depend on these meals. Sometimes when you look at schools, the breakfast and lunches are their only source of food. And it's so sad and it's so hurtful. It just breaks my heart. So I just ask that you not do these cuts because it's so important to our students and our families. You talk about kids, our seniors getting ready to go to college. It will be difficult for them to get the financial aid and college Pell Grants for college. You're talking about students that will become more homeless with the less housing assistance. And just less support means that our students will fall further behind academically. And we just do not need these cuts.
Yeah. Heather, and then I'll go to Shannon.
So probably two things kind of jump into my mind immediately. The first thing is that summer is typically considered like the slow season at the hospital, right? Nobody wants to be sick and inside and having surgery in the middle of summer. No one wants a cast in the middle of summer. So typically summers are slow season. Last night, when I left my shift at work around 8 p.m., our emergency room typically has a comfortable space for 30 to 40 patients. We had 77 patients in our ED last night. We are packed to the hilt, and they're already spilling out the doors, okay? Our communities are getting sicker, and they are living longer. And those are two things that cuts to healthcare do not support. The second thing that I would probably say is I had a really good conversation with a coworker the other day about dental care for her daughter and how she was talking with her dentist, and the dentist had said, you know, it's crazy. It used to be we made all of our money cavities and fillings and root canals and that kind of stuff. And now, because people are taking so much better care of their teeth, we're not seeing all that stuff. So now we're doing like other things like, you know, the whitening and all the other stuff in the office to like other streams of revenue for them. And I said, so Donna, what do you think if this bill passes through and Medicaid gets cut, right? And healthcare takes a turn, right? A simple cavity, right? For a grown adult, they may put it off. Then that cavity turns into an abscess. And then that abscess turns into a bone infection.
Yep.
And then that bone infection turns into a graft, right? So instead of our society having a good preventative care system in place that promulgates the idea that you should go and continue getting preventative care to prevent what could happen, we will have multi-million-dollar surgeries being done on patients that could have been prevented had they been able to seek and get the preventative care that would have eliminated the need for these longer, arduous procedures in the end. And that in and of itself is a travesty.
Wow. Wow. Shannon, I'd be convinced.
I've thought about this question a lot just because I live in such a large state, but we're such a small community. I have told my senators, I have told my representatives, I'm your neighbor. I'm the one who sits next to you at church. I'm the one in the hospital that in the middle of the night, when you're in there for a procedure and you're scared and you're worried and you're concerned, I'm the one who's going to be in there holding your hand. I'm the one who speaks for my patient who has schizophrenia, who's not going to have his medications, and therefore he can't go to work and may end up homeless and on the street simply because he won't have the ability to pay for his medications through Medicaid. I'm that person who's laying in a bed in their house, who is dying from bone cancer, who has days left, who isn't going to be able to have their morphine, and who's going to be in pain and suffering if Medicaid is cut. And so I'd ask them to remember that I'm not a number, I'm a person. I'm the person who is going to be the voice for the vulnerable. I'm going to be that shoulder when you need someone to lean on. And I'm going to continue to fight for those who can't fight for themselves.
Wow. Listen, I'd rather have the three of you running for office and being in office than so many of the people who are in office right now. The caring that you show, the works that you do on an ongoing basis. It's just awesome and inspiring. And I can't thank you enough for spending the time on this podcast today, really unpacking the hurt, the pain, the suffering, the cruelty that is coming with a bill that some of these Republicans are calling getting rid of waste fraud when it's getting rid of real health care for millions of people and the effects up and down the line for families. So I just want to say, Shannon and Heather and Laquetta, thank you so much. From Virginia, from Connecticut, from Alaska, we're hearing red, purple, blue, don't matter. The effects are going to be the same. This bill will hurt people all over the country. So thank you for joining us. And for everyone else who's listening, you got a few days. You can actually write your senators right now. Follow me on Blue Sky, follow the AFT, follow us on Twitter. Write to your senators right now and say no to this big, ugly bill, this big betrayal, this reckless, dismal thing, just this disaster on humanity. I think that's what you said, right? So we all kind of have different words for it, but it's a bad bill. We don't want it. And we want people to actually be supported and have better healthcare, not worse healthcare. Have better nutrition, not worse nutrition. Have funding for schools, not less funding for schools. Have opportunities to go to college, not less. So thank you so much, Shannon, Heather, and Laquetta, for joining us today. And for everybody else, this is Union Talk.
I hope you enjoyed this episode of Union Talk. Remember to subscribe wherever you listen to your podcast and tune in every other week for a new episode. Thank you, be safe, and be well.